It's a difficult conversation, but it's one that people really do need to have with their loved ones.
We're talking about Medicare's role in end-of-life care. Joining us now is Dr. Adam Herman, Chief of Palliative Care at Rochester Regional Health Systems.
Thanks for being with us today.
Thank you for having me.
Doctor, when we talk about this issue, I think a lot of people who have loved ones who are of Medicare age, right,
Sure.
Are sometimes a little hesitant to want to talk about the options, right? And there's so many things to discuss because it brings about one's mortality. But you're saying that having this discussion is essential, and then understanding Medicare's role in it in terms of what's covered and what's not covered, right?
Yes, I think it's critical. So many people say or that they want to be at home for end-of-life care, but yet only about a third of Americans actually have that happen. So it's really critical that patients, especially of Medicare age 65 and older, have these discussions with their family members, their friends, and their physicians to appropriately document what they want so they can get their wishes for care.
This all starts with what? A simple piece of paper, right? I mean, or even just a conversation. What's the best way to get the ball rolling on this?
I think the first and most important thing is to have a discussion, and that's what the CMS rules have recommended, that they will reimburse physicians to have these discussions. It's first to learn what the options are for care at end of life. Second is then to determine what the patient wants, what the patient's wishes are. And the third is to share that information.
But how does a doctor bring that up in the course of an appointment for something, say, routine, or do they schedule an appointment specifically to talk about this?
Well, that's what's unique and good about this new ruling, is that they want to offer the opportunity for physicians to set up separate appointments to actually have the discussion around advanced care planning.
Okay.
Do you have to get a will involved? Do you have to have this in writing before something happens, before you get to that needing end-of-life care? Or is this something you can just tell a family member and the doctor can take that as what the patient does want?
I think it's really critical to have the discussion, but it's very important to have something in written form. And those come in sort of three different ways. One is a living will, which sort of expresses wishes of the types of care that you would request or want. Second would be something like a healthcare proxy, identifying a specific person that knows your wishes, that knows how you think, that can really respect your wishes for care at the end of life. And third, in New York State, there's something called the MOLST form, or Medical Orders for Life-Sustaining Treatment. And this is a form that you can go through with your doctor that sort of clearly expresses what your wishes are if you have an advanced or terminal illness.
Right, and how invasive you want them to get when it comes to prolonging your life, right, or extending your life through, right?
Exactly. So things talking
resuscitation or not resuscitation, or not resuscitating. Okay.
Yeah. So artificial resuscitation, breathing machines,
feeding tubes,
any number of invasive options. Most patients, when faced with the idea that they have a terminal illness, actually want less. They don't want more. They want to spend time with family. They want to spend time with loved ones. They want to spend time at home and less time in the hospital. So when we have a sense that someone has an advanced illness or a serious illness where we need to discuss these difficult topics, I think it's important to give that opportunity to the patient.
But it's also important to talk about it now while a person's really healthy. You know, I can't imagine what it must be to get bad news and then to have to make all these decisions. But then again, we don't want to talk about this when we're healthy either. So it's difficult. Doctors have to sort of be very cautious about how they bring it up too, right?
Yeah, very cautious, and but open. And I think when you have these discussions, it's really about saying, we want to put you in charge. We don't want this to be a crisis situation where something happens and we don't know what you want, and then we're forced to sort of guess.
Now, this is for patients 65 and older. Do you suggest that this be something that even younger patients do?
Yes, I do.
Younger people, I should say?
Yes, I do. I think it's important for all adults to begin to have discussions and identify who their decision makers might be if they couldn't make decisions. So a healthcare proxy is an easy way.
Where do you get those?
You can get those online. You can get them from your doctor's offices. Most of them will try to offer you that information. And I think it's a great opportunity to begin to document your preferences for care.
That's fascinating. It really is.
With the end-of-life care, how does Medicare play a role? Is it something, I mean, do people need to save more money than just depending on Medicare?
No, Medicare's role really with updating the CMS rules this coming year is really to focus on having the discussion. You don't have to have something else be a problem. It can be part of your normal visits with physicians to discuss end-of-life care or your preferences for care.
Mm-hmm. Are doctors reimbursed for these visits?
Currently, they're not if it's a separate visit for advanced care planning, and that's what these CMS rules are bringing forward, is to reimburse as a Medicare benefit these discussions which families and patients want.
Okay, that way doctors are more likely to do them too.
So this will start in 2016?
2016. So when you ask patients, 81% of them want to have discussions covered by Medicare to talk with physicians about advanced care planning.
Excellent. Doctor, thank you so very much. This is so fascinating. I hope you would...